Welcome to MedAxiom HeartTalk, where thought leaders come together for one ultimate goal: to continually transform cardiovascular care for all. MedAxiom HeartTalk starts now.
Hi, I'm Melanie Lawson, host of MedAxiom HeartTalk, and today we are joined by Tom Draper, Vice President of WellStar Center for Cardiovascular Care, Dr. Barry Mangel, Chief Cardiology Officer at WellStar Health System, and Denise Busman, Vice President for Care Transformation Services here at MedAxiom. Thank you all for coming in to talking with us today.
Thank you.
So today we are talking about strategic planning for the high-performing CV service line. And Tom, I'm going to ask you the first question. Sure. So every practice wants to run efficiently. Can you share insights into your external to internal leadership perspective and how it has benefited your practice?
Yeah, the external benchmarking is really important to us. When we look at our operations, we like to look at the benchmark. MedAxiom is one of the tools that we use. We use other SG2 or advisory board or Vizient, and that really gives us a good sense of how our current state operations are running. And then as we develop that strategy, it really helps us to then benchmark to others to see where we have those opportunities, and then it really focuses where we develop some of our tactics. And in the world of efficiency of running a practice, that's probably one of the most important areas. Because if we're not running efficient, we're not able to grow, we're not able to get patients in. So leveraging that external data to bring it to what it means to us is something that we really focus on as we develop our strategies.
Yeah, and it works in any industry.
Absolutely.
You know, I can imagine as well. Dr. Mangel, let me ask you this. Has this perspective impacted you and your teams at a clinical level?
It absolutely does. I think that, being able to zoom out a little bit gives us a perspective on care that informs the work that we do. And so, as an example, looking at what's going on nationally, looking at what the ACC and others are talking about, tells us about trends. It tells us about areas that we might want to be focusing on over the next few years. And that includes operations, as Tom pointed out, but I think it also includes clinical care because operations impact clinical care and vice versa. So from the standpoint of being external, we really need to do the work to look at what's going on locally, regionally, nationally, and really everywhere. I think it's very important to do that work as part of the strategic planning.
Yeah, it looks a lot different when you see it from that why perspective, definitely. Denise, let me bring you in the conversation. Yeah. So what do you see as the top 2 or 3 key initiatives that practices should be focusing on right now?
Oh boy, there are so many things to focus on, and I think we could talk about this for a long time. But a couple of things that immediately come to mind is understanding how we bring value into the equation. We've talked about it for a long time, and to actually execute is a whole nother issue. When undergoing strategic planning, that's one of the conversations we can have to understand the sorts of programs that we build and the kind of quality that we bring to those programs will help us bring then value to the patient. It's meeting that quadruple aim. So I think that is one key thing we need to focus on. The other thing that we've all been so acutely aware of is the way our workforce is changing. We know that cardiologists are increasingly short supply. We've got a lot that are aging out. I'm kind of to that point in my career where I'm, on the upper end of where my career has been. And it's important to be able to grow new leaders and grow new clinicians so that they're ready to take the mantle and understand how to be leaders for the future. So it's both continuing and growing the workforce and then managing the care that we provide such that we bring value.
Right.
And Denise, I like that point about value is too often when developing strategy, it's about where are we going, new markets or new programs. Quality absolutely has to be part of our strategy. And it's so important because quality then leads to everything else.
Sure.
Good quality will then drive market share, will drive better cost and just overall better performance for the practice.
Right, and understanding that and having those discussions up front are really the sign of a healthy organization that understands capabilities, what they could and should do. So there's just because we could do it doesn't mean we should do it, or we should do it, and how can we do it?
I would add one more thing, and that is that the understanding the workforce is really important now, because we are the workforce is different, and so in order for us to strategically plan for our clinical needs into the future for programs and various geographic locations, we have to understand the workforce and what they're looking for important things like recruiting and retention. So that builds into it. It's a completely different dimension, but incredibly important.
Boy, and if you don't have the right people, even though you've got great programs and you've got great work to do, it's just not going to happen.
Yeah, hard to execute. And also, I imagine being nimble and being able to pivot that plan when things do change, because that is inevitable.
Yeah, understood. Yeah.
Thank you, Denise Busman, for joining us. Tom Draper, Dr. Mangel, appreciate you joining us for this Heart Talk.
Sure.
Thank you.
Thank you.